In this module, I would like to give you an overview on obstructive sleep apnea syndrome. As you all know, sleep apnea is a very highly prevalent condition which is potentially life-threatening not only to the patient but also to the others. It can be very easily diagnosed, at least in clinically significant disease patient, and it is very easily treatable. What I am going to do basically to give you a definition of sleep disordered breathing, what are the different types of sleep disordered breathings, what is its epidemiology, pathophysiological mechanism responsible for development of apneas and hypopneas, clinical presentation, consequences, diagnosis, and finally, what are the different treatments available to us. First, we go into the definition of obstructive sleep apnea. As you all know, any breathing which results in sleep disruption is called as sleep disordered breathing. And there are different types of disordered breathings which one can see in these patients. They can be in the form of apneas, hypopneas, respiratory effort related arousals, or simply changes in their heart rates as well as blood pressures. Now, most commonly seen disordered breathing forms are apneas. As you know, that sleep disordered breathing is caused by partial or complete collapse of upper airway during sleep as a result of pharyngeal dilator muscle relaxation. Now, apnea is basically a complete collapse or complete cessation of airflow for more than 10 seconds in a patient. This may be associated with significant desaturation and arousal, but for the definition of apnea, these criteria are not included. On the other hand, hypopnea is the result of partial collapse of the upper airway and is associated with decrease in more than 30% of flow from the baseline, which should last at least for 10 seconds and should be associated with at least 4% desaturation or 4% oxyhemoglobin desaturation or an arousal. So, if you see here in this polysomnogram, you can very clearly see where you have the red bars that there is a complete cessation of flow, and then this is terminated by arousal, and then patient breathes for some time and again there is no flow and then there is an arousal.